This evidence-based appraisal aims to answer the clinical question of whether splinting post-burns is an effective method to increase functional range of motion and prevent contractures. The research article is a systematic review and expert consensus on the use of orthosis with adults and children after burns injury to determine practice guidelines. This research was conducted by Parry et al. In 2019. The research aims was to systematically evaluate the available literature addressing the use of orthosis with adults and pediatric burn survivors and determine whether or not practice guidelines could be proposed. The other primary research aim was to investigate if orthosis use in burns rehabilitation should be considered as a treatment choice for improving range of motion or reducing contracture incidence in adults. The study design and methodology was a systematic review which looked at various different data sources from CINAHL, Medline, Pedro, ProQuest, and PubMed, to name a few. There was an initial number of 2,866 articles that were found, and the total number of studies that we used was 50. The inclusion criteria for this study included burns survivors who were treated with an orthotic device, including a splint, cast, or other, a range of outcome measures including range of motion, the presence or incidence of contractures, the need for reconstructive surgery, or pain. The journals had to be published in either English or the French language. The exclusion criteria included those with no burns or no orthotic device used, outcome measures which did not include the ones described in the inclusion, no outcome data provided, orthosis was part of a larger therapy regime and no attempt to evaluate the orthosis was made, conference abstracts and review papers with no original data. There was a stringent data analysis process, and this included all studies being systematically critiqued and scored by at least 3 independent reviewers, drawing on the critical appraisal form designed by Law et al. The 3 reviewers independently extracted details required to complete the critical appraisal form. If at any point there was any discrepancies by more or less than 2 points, an additional external reviewer was called upon to critique the article, and thus a consensus was always achieved amongst all the reviewers. During this process, 7 further articles were excluded because they did not address the PICO question, the data provided in the article was deemed vague with insufficient explanation of the methods used to assess the outcomes, or the outcomes could not be isolated to the application of appropriate orthosis. When looking at the critique results, 18% of the citations were less than 5 out of a possible score of 14, however the articles were retained for completeness. The remaining studies scored 5 to 9, and 8% scored more than 10. In terms of the study characteristics, 5 were randomized controlled trials, 2 cohort studies, a series of 21 which included 15 prospective, 4 retrospective and 2 not reported, and a sample size of randomized controlled trials which ranged from 4 to 52 participants in each study. When considering the results, 4 out of the 5 randomized controlled trials showed benefit from the use of orthotics. 86% of all studies showed a neutral outcome, and 10% showed a negative outcome. When considering the interpretation of these results, despite the majority of studies in this review reporting positive outcomes, the use of orthosis is so varied that the evidence is too weak to support recommendations for new standardized treatment. Therefore, the only practice guideline that could be recommended from this systematic review is that orthosis should be considered as a treatment option for improving range of motion or reducing contracture incidence in adults burn survivors. Let's now critically appraise this systematic review and draw conclusions on whether this information can be used for current and future clinical practice. The strength of the study is that the objective was clearly stated. It was the largest systematic review to date about the use of orthosis for burns survivors. There was a stringent inclusion and exclusion criteria. Multiple databases were searched, and quality assessment was performed with 3 independent reviewers and an additional board member to rule out any discrepancies. The limitations of the article is an inadequate summary of the included studies. The settings of tests, objectives, study design characteristics, and demographics of the participants were not reported. There was an inability to compare physiotherapy-specific interventions with best practice guidelines. Orthosis application method and parameters were not clearly defined. The positive points for the study validity is that it can be easily replicated. The study was conducted so the results are true for the cohort and the sample that it was studied, and there was no misleading graphics or overrepresentation of the results. The negative aspects is that no definitive conclusions can be drawn pertaining to best practice guidelines or standardized care for the application of orthosis for current and future practice. Moving on now to reliability. There was a stringent study characteristic and methodology. There was relevant inclusion and exclusion criteria to ensure that studies considered remained relevant to the research aim and PICO group. There was a standard deviation for most measurements and a confidence interval of 95%. Moving on now to the negatives. The age of these groups was not included, and the degree of burn sustained was not stated. This can impact on the categorical management of burn survivors when considering patient problem prioritization. Having a look now at the clinical significance and the applicability to the case study, whilst the systematic review was unable to definitively identify best practice guidelines for the use of orthosis, it was highlighted that 88% of the studies showed a positive improvement when it was used for at least 23 hours per day. Therefore, the only practice guideline that could be recommended from the systematic review of this literature is that the use of orthosis should be considered as a treatment option for improving range of motion or reducing contracture incidence in adult burn survivors. Let's now highlight what was learnt from this systematic review and see how we can apply this new evidence to Ranesh in the case study. The use of orthosis will allow for improvement in joint range of motion and reduce the incidence of contractures. This will most likely decrease his pain and improve overall function. Therefore, the use of orthosis for Ranesh is indicated.